We're keeping up with all the changes surrounding the Delta variant and vaccine as information is updated day by day. And joining me now is to give us the latest information, Dr. Karin Shavelson, Chief Medical Officer at MarinHealth. Thank you so much for being here.
My pleasure. Thank you.
So first things first, we're seeing a rise in cases. Do we know what is driving the increase in these cases in the Bay Area specifically?
Yeah, right now it's all Delta variant. We see the sequencing of the positive tests, and throughout the Bay Area, it's 90% plus Delta variant right now. This is a really effective variant. I liken it to a heat-seeking missile, and if you're unvaccinated, it will find you.
Wow, cases are on the rise also in Marin County, but how does the surge look different this time around?
This time it's primarily the unvaccinated. As I said, if you haven't received that vaccine and your immune system isn't prepared for Delta, you're in trouble. Now is the time to go get your vaccine. Remember, it's going to take your immune system a couple weeks to fully arm itself. So even if you get vaccinated today, it's imperative you wear a mask everywhere, inside for sure. And if you're outdoors near people and you're unvaccinated, please wear a mask. It's imperative right now. We're seeing spread that is unprecedented. This is a very contagious virus.
And, as kids get ready to go back to school, children under 12 don't have the option to get vaccinated. So there's been a lot of changes happening. San Francisco Unified School District joined multiple other districts in announcing they'll require vaccines or weekly testing for staff. Now, is this a step in the right direction in hopes to keeping this virus out of schools?
Absolutely. I can't emphasize enough how important it is that anybody around unvaccinated pediatric patients or the pediatric population, they need to be vaccinated or tested. If you're under 12 years old, you don't have the option of getting the vaccine. You rely on the adults around you to do the responsible thing, which is to be vaccinated. Testing is great, but really the best thing everybody can do right now, particularly if you're around children, is to be vaccinated.
And yeah, many people are pushing for vaccines to be approved for children. But in the meantime, what are some of the things that we can do to protect them? I know wearing masks and things like that, but what else can we do?
Well, vaccination, of course. Masking is imperative. If you're unvaccinated and you don't need to be around kids, I would highly recommend that you're not around kids that aren't vaccinated. That would be great. Social distancing and washing our hands, all the things that we've learned to do during this pandemic that I think everybody was a bit hopeful that in May and June, when we opened back up, that we could move on from these things. But listen, we know how to do it. Mask, get vaccinated, get tested if you don't feel good. Stay home if you don't feel good. Don't come to school. Don't come to work. Yeah, there's a lot of viruses going around right now, but you don't know if you have COVID or not. And we are seeing breakthrough infections. We are seeing people who are vaccinated. They are getting COVID. The good news is they aren't getting really sick and they aren't going into the hospital, but they're getting COVID. So even if you've been vaccinated, please don't assume you have a cold. You need to stay home and get tested.
Yeah, that's a good point because cold symptoms obviously are very similar to COVID symptoms as well. So getting tested is a very good idea. Thanks so much for this information.
My pleasure. Thank you.